Axeview here. Last episode we talked about what the Affordable Care Act is, otherwise known as Obamacare. We talked about how Obamacare had two goals: to insure the entire country or close to it, and to lower health premiums for the majority of Americans. And Obamacare sought to do that by expanding Medicaid for poor people and giving subsidies to middle-income people so that everyone could hopefully afford health insurance. But did Obamacare do that? Well, a good place to start is the uninsured rate. The uninsured rate has fallen dramatically in the last few years since the Affordable Care Act was enacted. So that's good. Over 90% of Americans have health insurance now. For one, the uninsured rate hasn't hit 0% because the Supreme Court ruled that the states could decide whether to opt in or out of Medicaid expansion. Therefore, the poor aren't necessarily covered in those states. Additionally, Obamacare sets certain eligibility limits for middle-income people to be eligible to have a subsidy or not. Therefore, some people weren't eligible to have a subsidy even though they're not really that rich or not even that poor to have Medicaid either. But the other part of the question is critical. Are health insurance premiums and deductibles lower or increasing at a lower rate than they were before the law? This is where it gets rough for Obamacare. Deductibles are still increasing at the exact same rate or nearly that of before the law. And premiums continue to go up, but actually at a slower rate than the previous 10 years. So there is some progress here. But why are deductibles still increasing so dramatically, even above inflation and average income? The cause for this is actually built into the philosophy of the law itself. The law also prohibits health insurance companies from denying coverage to people with pre-existing conditions, so therefore all those people necessarily signed up because they need coverage most of all. But we need healthy young people to sign up too, so that their costs are shared with the expensive people and premiums and deductibles come down as a result. But what happened? Young people just didn't sign up. Why not? Because even if you get a subsidy, that percentage of your income that it's capped at might still be more than you can afford. Paying a tax penalty that's only a couple $100s a year might be less expensive and more rational than paying thousands of dollars for health insurance when you're young and healthy and probably don't need health insurance after all. So that's the problem with the law. Young people aren't signing up because it might be too expensive for them, and sick people are signing up because they need it, leaving health insurance companies with no money to cost share to cover those sick people. Therefore, insurance companies back out of the marketplaces because they can't afford them, and they actually aren't making any profits or even running losses. When more and more young people refuse to sign up for health insurance because it's more expensive than paying a tax penalty, that leaves health insurance companies with only sick people to cover and no premiums from the young people to cover the cost of those sick people. Therefore, it creates a death spiral where health insurance costs keep getting more and more expensive, and health insurance companies actually start running losses and have to back out of the marketplaces, leaving there no competition in the market at all. So now some states are left with only a single insurer left in the marketplace, leaving there to be no competition and even more increases in prices. Health insurance companies are also taking on more cost because there's no restrictions on when people can sign up for health insurance or not. Therefore, someone can get sick and then immediately sign up for health insurance and then drop coverage when they get healthy again, leaving the insurance company to only cover people when they're sick. With all these losses going towards the insurance companies, you would think that they might need a bailout. Since bailouts are politically unpopular after the 2008 crash, Republicans started to block that part of the law. Obamacare actually sets up a fund to help out insurance companies when they take on so many losses in these formative years of the law. So that's the problem with Obamacare. Without young, healthy people signing up, the whole system starts to fall apart. Fewer young people equals higher insurance costs, equals fewer and fewer health insurance companies staying in the marketplaces, leading to no competition, leading to even higher prices, leading to no one buying health insurance anymore except for the very sick people, leading to even more high prices. That's the death spiral that could be caused by this law. On top of all this, pharmaceutical companies can charge whatever price they want for a drug, even if it costs 10 times less in another country, and medical device manufacturers can sell a part to any hospital regardless of the price because sick people need them. Even with all these problems, there are ways to fix the law, and that's what we'll discuss in the next episode. Thanks for listening, and continue elevating the conversation.